A Wichita Falls mother is in the national spotlight after investigators say her 4-year-old son was hospitalized more than 200 times for fake ailments.
30-year-old Megan G., who is suspected of having Munchausen Syndrome by Proxy, was arrested in Wichita Falls last week for serious bodily injury to a child. According to the arrest affidavit, G's 4-year-old son was taken to a medical professional 227 times in just 4 years, accounting for about 33% of his life.
Between 2016 and 2017, the boy was taken to hospitals here in Wichita Falls and Fort Worth. In one incident, investigators say doctors at Cook's surgically inserted a feeding tube into the boy's stomach after G reportedly asked doctors to put the tube in because her son was not eating.
In 2017, the boy was put in foster care, where the woman who fostered the child said he did not have any symptoms previously described by his mother and did have a hearty appetite while in her care. Last year, G's son was diagnosed with autism. According to the arrest affidavit, G retained custody of her son in February when the CPS investigation into her wrapped up.
CPS investigators believe G could have Munchausen Syndrome by Proxy. Now, Shatanya Clark sat down with a few local mental health experts about how this mental illness affects both the parent and the child. Shatanya?
Melanie, doctors do not know what causes this behavior, and even though those I spoke to don't want to speculate on the G case, they say in most instances the parent, typically the mother, wants to be the center of attention.
I encourage everybody, if they suspect any form of abuse with children, regardless of age, to act on it.
For almost 26 years, Sheila Catron has worked with children who have suffered some form of abuse or neglect, one of which, though rare, is Munchausen Syndrome by Proxy.
That's usually when a child is getting treated for unnecessary illnesses.
Parents with this disorder intentionally make up illnesses a child has, or in some cases makes the child sick. Clinical psychologist Dr. David Sabine says they do this to gain attention, and the most difficult thing about this disorder is the parents' denial.
The only recourse is to remove the children, and then if the parent is willing, which is rare, but if they're willing to, years of psychotherapy, there's not a medication you can take, there's not any kind of quick fix.
And Sabine says doctors prescribe medications out of the good faith of the mother.
Usually the things that mother alleges the child is suffering from or that she's created in the child are vague, like pain or chronic migraines. Anytime you present for medical treatment, the doctor is going to take the most simple and direct approach to treating the symptoms. So it doesn't occur to the doctor that this could be completely false.
Once the doctor suspects something and the children are removed from these situations, though, all is not lost.
Children who tend to suffer abuse and neglect, when they are removed and brought into our environment, the shelter environment, the foster care environment, or anything, they will assimilate to their new environment.
Both Catron and Sabine say any suspicion of this disorder should be reported. The sooner it is cited, the better. And research shows that about 1% of people meet the criteria for the mental illness, but there is no statistic on how many people suffer from the disorder. Now, Sabine also said if this goes on long, at about 11 years old, children become more aware and understand that something is wrong.